Salams from the People's Dispatch studios in New Delhi. I'm Siddhantani and you're watching Daily Debrief. On the show today, 12 refugees have been found dead on the Turkey-Greece border. We look at Australia's crisis of healthcare for its senior citizens, and we talk about the 150th Executive Board meeting of the WHO. First up, the bodies of 12 refugees were found inside Turkey near its border with Greece. They were found partially clothed, and believed to have frozen to death. Turkey's Interior Minister Süleyman Soylu stated that the bodies showed sign of frostbite and were without shoes. He added that the 12 were part of a group of 22 who were pushed back by Greece. The country has been, Greece that is, has been repeatedly accused of this practice, which is illegal under international law. Greece, of course, has denied the allegations and also refuted Turkey's statement. Abdul joins us now. Abdul, first of all, do we know who these refugees were and where they were fleeing from?
No, we are not sure about it. So far, the identity of the refugees have not been revealed. Most likely, they will be either Syrians or the Afghan refugees because they are the main chunk of around 4 million people who are staying in Turkey at this moment. And a large part of these refugees, since there is no hope of going back home because the war is stretching both in Syria and Afghanistan, the humanitarian situation is bad. There is no attempt to kind of create some kind of stability in these countries by the international community. So there is no hope among the people who are living in Turkey. And also the Syrian refugees and the Afghan refugees living there are facing domestic backlashes from the people from the right-wing groups in Turkey, which see them as quote-unquote threat to their livelihood and so on and so forth. So they have no other option but to kind of move to places where they think they can get some kind of economic
better protections, etc.
security. Yeah. So that most likely, we are not sure about it, most likely Syrian or the Afghan refugees. Yeah.
Right. So, Abdul, Turkey has been declared a safe third country, and all of this is kind of forming a large part of Greece's migration policy, on which basis, I suppose, this question of pushbacks comes up. What exactly are pushbacks and what evidence do we have that this is being practiced?
I think International Organization for Migration and both the UN Refugee Agency, both of them have thoroughly documented this particular aspect in which the European Union, not only Greece or Poland, it is not about Greece and Poland individual countries. Of course, these countries are relatively poorer parts of European Union. I'm referring to Poland primarily because the incident happened in November, which led to the large diplomatic row between Belarus and the European Union, which became an international issue. There also some refugees died because the Polish forces pushed them and there was a quote-unquote clash between them and the security forces. So it is not about these relatively poorer countries taking individual steps to force people who are trying to kind of seek refuge in European Union, which is considered relatively safer and quote-unquote more prosperous. It is about the larger policy of European Union, which basically does not allow, which basically discourages all kind of refugees, all kind of to kind of seek asylum or to come there and work and get stability because of its own reasons. The reasons are quite obvious. The European Union think that the rising is rising, their economic condition is not good, they cannot accommodate so many people, and so there is a part of exaggeration also. It is not that millions of people are going there. Majority of the refugees are staying in the third world countries like Turkey or countries like Lebanon or in countries like Pakistan. They are not going to Europe. A few of them who are going to Europe, they are not ready to, the European Union is not ready to accept it. And they force, and every year, because of this force, they are arrested while they attempt to go to European Union. They are kept in detention centers. Those detention centers are pathetic. Their condition, living condition is pathetic. Every year, hundreds of people die. According to the International Organization of Migration, last year, around 2,500 people died either in sea or in the camps which were set up for these people who are detained. So it is a fact that hundreds of people are dying, and mostly because of the what we call hypocritic policies adopted by the European Union, which at one time talks about human rights, but on the other side, it is not ready to accept people who are basically migrating from their places primarily because of the wars waged by European Union in alliance with the US and other Western countries. So it is a very pathetic situation, and it basically exposes the, as what Turkish Interior Minister said, it is an inhuman condition. Just last point I'll mention that Turkey, which is hosting around 4 million refugees, European Union, in order to prevent the hundred of people who move from Turkey to European Union, prevent even the movement of these many people, European Union is willing to pay Turkey so that it can keep the refugees there. Instead of taking them and letting them go wherever they want to go, they are doing this kind of policies. And if they are not able to, if Turkey is unable to prevent people from moving, the force is used. That is what the ground reality is.
It reminds me of Gianni Infantino, the FIFA president, his very unfortunate recent statement where he's saying they are migrating, literally he said, they're migrating, let's give them another World Cup. Thanks, Abdul, for that update and for joining us on Daily Debrief. A recent report coming out of Australia highlights today another aspect of the inequality that has emerged as a leitmotif since COVID-19 went pandemic. In this specific case of the current dominant strain of the virus, Omicron, the Australian Aged Care Collaboration, which is a group of 6 aged care peak bodies, has released a care situation report highlighting the issues that care providers and staff are facing to protect older Australians. Not just from the virus, but I suppose in general. Anish, what are the key findings of this report?
The report in general, states a lot of factors that has affected the aged care and has actually caused the aged care crisis right now, the aged care centers crisis, because it has been going on since at least 2020. This is something that is repeating itself. It's sort of like a tragedy repeating itself twice, and it makes it has created a situation where aged care residents are kind of right now among the most vulnerable groups right in Australia. We have to remember that about 500, close to 500 out of 499 deaths were reported in January alone. Now, if you actually put that in context with the overall deaths that Australia has reported in January, that comes to around 27% of the deaths. This also considering the fact that a very small proportion of Australia's senior citizens actually are in aged care centers. So this shows a certain kind of crisis that is almost unparalleled in any other sector of the healthcare system that Australia is facing right now. And the Omicron variant has only exacerbated this. This was something that was also witnessed in 2020 when they had the first wave, and aged care centers were again among the most vulnerable sectors at that point. Close to 700 deaths were reported, and even then almost nothing was done so far by the Scott Morrison government to correct this situation, because it is compounded by a staffing shortage that has been spiraling to the point where we are looking at a situation where every day about 20% of the shifts go completely vacant, because the existing workers really have to prioritize shifts and the kind of care they are going to give to the residents in there. And this has, we are looking at on an average 140,000 shifts being completely vacant in aged care centers across Australia. That is not a small matter.
Both public, private aged care centers, or largely private?
Both of them. It's an overall picture we are looking at right now.
Right.
So, and more than that, it's not just the deaths that we need to remember. It's also the fact that right now, close to 24,000 people, not just residents, but also workers and staff, health, care providers in these centers across over close to 1,300 centers are are infected right now. They are, so these are active cases. These are not the past cases. So we are talking about the past cases. That actually brings it to a much larger picture number. So this kind of crisis is almost taken. It's becoming a national issue. Of course, you have the opposition coming out, hammer and tongs against the government. But at the same time, the government's response has been quite lacking. And this, the kind of promises that they're making right now are quite short, very late, and it's not enough to actually mitigate the disaster that is unfolding in front of us.
Anish, I have quite close contacts that work in childcare in Australia, and the demands that sort of workers are making in that sector of the overall care industry or the care sector are very similar. So why is this sort of a section that is being particularly sort of not listened to?
It is not just this one section. Actually, if you look at the healthcare sector overall, over the past several months now, healthcare providers, and also your support staff, cleaners, canteen staff, all of them have been protesting against low wages, against lack of PPEs, against non-priority in vaccination, all of these things. But aged care sector in general, because most of them are run by private groups, there are issues there coming up when it comes to wages, when it comes to actual care provided, even vaccine distribution. We have to remember that more than 500 centers so far are yet to receive a single booster dose. So right now, and it has been more than a month, over a month now, that the Australian government has started rolling out booster doses for senior citizens. Right. So in general, you're looking at a healthcare crisis. It's just that because aged care centers are smaller, there are a smaller number of people, and because it is largely privately run, you have this crisis being exacerbated in an institutional manner. So a large number of workers are looking for wage reforms that has not been happening for nearly a decade now. And this is something that puts their wages just barely above the federal minimum wage, which is already something that is not enough for them to make a living. Yep. Exactly. And on top of that, many of the aged care providers have to, spend their own resources to ensure that some level of quality is maintained in these centers. And this is also not something that has been addressed so far. So we are looking at complete sort of neglect on the side of, because we have to remember Omicron is a crisis that has been happening across the world. Almost no country is immune to it. Everybody is, every other government is actually facing a big challenge trying to stem this spread. But at the same time, when it comes to in Australia, this particular crisis is not something that can be just put on Omicron spread. Omicron spread is something that is just normal, like it is happening everywhere, everybody is dealing with it. But this particular crisis is something that is caused by a specific neglect by the Scott Morrison government, because they did not make enough enough provisions available, enough vaccines available, enough care providers available for these centers.
And of course, testing kits, which was a critical aspect in all of this story. Exactly. Thanks so much for that, Anish. Our next story and our final story for the day is also connected to the pandemic. The 150th session of the Executive Board of the WHO was held at the end of January 2022. Usually, this is an annual meeting where members agree on the agenda for the World Health Assembly, which is normally held in May every year. However, this is the first time the board of the UN's health agency is meeting since it declared COVID-19 a global health emergency 2 years ago. PD spoke earlier to Gargia from the People's Health Movement Secretariat, who's part of a team following the meeting and what was agreed on.
It's the second year from the time the pandemic has been, COVID has been declared as a public health emergency. And what we see that even after 2 years, what we face is not at the start, 2 years back, it was an issue of science where we really did not know much about the virus. We did not know much about how to deal with it, what sort of medicines will require, what sort of vaccines we require. But 2 years later, the progress as far as scientifically is concerned has gone ahead very well. And you'll see that, despite all the progress, what we face now is a gross inequity in the way these products of science have been distributed. And in these 2 years, we have seen countries, have different waves of the COVID pandemic. We had the variants, as we already know. There was a Delta variant and the latest one, Omicron. So this meeting was also happening in the backdrop of Omicron variant and the related surge in cases across the world. But it looks like there is very little that we have progressed, because there are populations which are taking 3 doses on one. They are taking booster doses on one side, and there are populations which are yet to get even first dose. What is the role of WHO in this? Is the failure of actually taking the ownership of this manufacturing and distribution. As you might know, the coordination of manufacturing, of building together these medical products was kind of taken out of WHO in the form of a large multi-stakeholder, or we can call it a public-private partnership known as ACT Accelerator. And in that in particular, there is something known as COVAX facility, which was looking after, the vaccine productions and distributions across the world. And there has been this spectacular failure, which, after 2 years, there is a complete failure of these public-private partnerships in, rising up to the occasion. And why does this happen is at the core problem is the WHO over a period of time has become a very weak agency. And like every other United Nations organization, it has been having fund cuts. It has been having, issues of trying to delegitimize WHO in different ways of, let us say, saying that WHO might be inefficient and so on and so forth. And this also got exaggerated with Trump trying to pull out of WHO, and only last year did the US administration come back into WHO. They really did not leave, but the decision was taken to not leave. So you have in this context a very weak WHO, and one of the core issues or the core works of WHO is to coordinate these health emergencies and these global health emergencies, which are affecting multiple countries, and coordinate them and get policies across that help each other. But what we see here is also the learnings of the pandemic are being taken in a different way. Instead of actually strengthening the WHO, and also the learnings of the pandemic, which are basically that we really need a public sector and public health which is provided by the governments. We are seeing this across the world. Just because a country spends a lot on health doesn't really mean it was able to deal with the emergency well. A clear example is the United States, which has been failing miserably on various fronts. So it is in this context that this is happening. But what is happening is not just a few countries, but many countries have not been using these learnings from the pandemic to strengthen the process of a multilateral or a UN-led agency like WHO, but they are weakening it. How they are weakening it is, there is this fragmentation of decision-making that is happening. So one of those in particular in this EB was the proposal by Austria, where they wanted a standing committee on pandemic emergency preparedness and response. So what, and there are many such committees. Actually, you open the agenda or the, follow the executive board or the World Health Assembly. Even for someone like me who follows it on a regular basis, it's so confusing with so many parallel committees running and so on. What you increasingly see is, in the name of efficiency and doing it better, a typical corporate playbook is being employed here, where things are being fragmented so much that no single person or no single agency can be confident of proposing real suggestions or making real changes. And this in particular, in the context of a health emergency in the future, will be devastating, because you can't have 10 different committees within WHO doing 10 different things. And not just in WHO, there are multiple smaller organizations like World Bank and CEPI and so on and so forth, who follow and have their own influence on these issues. So we are looking at basically a corporatized, multiple corporations, philanthropies getting into health emergencies and the governance of it.
That's all we have on the show for today. You've been watching Daily Debrief. For more on these stories, you can visit our website, peoplesdispatch.org, and also give us a follow on all the regular social media platforms for updates. We'll be back same time, same place tomorrow. Until then, goodbye.